envision a community. We envision a community free from domestic sexual violence where healthy relationships prosper. We are a dual agency, which means we serve survivors or victims of domestic violence and sexual assault, which is very unique because that means that we are covering a lot of needs from the community when it comes to domestic violence and sexual assault. What our vision entails, we offer safety planning, assessing immediate needs. We can serve survivors on the crisis line. Walk-ins are also welcome. We secure access to community resources. We partner with a lot of agencies in Raleigh, North Carolina, and even law enforcement when it comes to helping our survivors. We offer advocacy services, empowerment. We can assist folks with finding jobs and making sure they're able to help themselves too and empower themselves. We also offer case management for long-term support that they might need. At the Solace Center, for our sexual assault services, we also offer the forensic examinations, which entails a sexual assault evidence collection within 120 hours of an assault, and I will talk about that more in detail later. We offer services for folks 16 years old and above. We have advocacy services. We have volunteers. We call them SARAs. They're called Sexual Assault Response Advocates. And they come and help our SANEs, which are the sexual assault nurse examiners, perform the kit. And they're there to support the patient. We offer case management, so follow-up services. We have to make sure that they're okay, if there's anything they need once we discharge them. We have virtual support groups, which are seasonal. So we have either summer, spring, and winter support groups. And of course, prevention and education, which is very important, what I'm doing now. April is Sexual Assault Awareness Month, so that's what I'm here for, to ensure that the community are aware that we do have, we can offer help for folks that have been sexually assaulted. And we are not only offering it for folks in Wake County. I mean, we have, sometimes we see folks from other states and even international. We've had cases where they happen internationally. So just a couple of numbers that you all might need from us. And I think this slide will come up also later, almost at the end of this presentation. I'm sorry about my dog. So these are our numbers that y'all can call, and we have an email also if y'all need help. All of our services are free and confidential. We have grant funding that is provided to us by a lot of our grant funders and federal grant funding. So just a couple of guidelines. So sexual assault is very heavy subject. So we always want to ensure that when we're doing this presentation that everyone is safe or feels safe. So if you all need a break or just want to log off for a minute, it's totally fine. We do understand the importance of taking care of yourself first, because again, this is such a heavy subject. So just a couple of definitions that I would like to touch on. I think a lot of us, well, according to studies, there's a lot of us that have experienced sexual violence in our lifetime. So any unwanted sexual contact, right? Whether it be physical or verbal, and I'm pretty sure even at your work environment, you have rules about, sexual violence that impedes your sexual autonomy, for example, doesn't make you feel safe. It's against your will. That is sexual violence, right? On a deeper note, sexual assault is such a broad term. Rape actually falls under sexual assault, but sexual assault just refers, generally to any sexual contact behavior that occurs without explicit consent of the victim, right? So attempted rape is a form of sexual assault. Fondling is a form of sexual assault. Performing sexual acts is a form of sexual assault. Penetration of the victim's body, which is rape. In North Carolina, I did put the definition here for that from the FBI, but in North Carolina, sexual assault is any penetration of the vagina or anus, however slight, is considered sexual assault. And those are, because some people sometimes get sexual assault and rape kind of interchangeably, but rape is a lot more heavier than sexual assault. So why are we here? So the statistics is pretty heavy in a way. So 1 in 2 women and 1 in 5 men experience some sexual violence in their lifetime. I know I have. I mean, I haven't been raped or anything, but I've experienced that in my lifetime. 1 in 4 women and about 1 in 26 men have experienced attempted or completed rape nationally. Over half of women, 1 in 3 men, and believe it or not, men also get sexually assaulted. We actually have seen men at the Solace Center, and most especially the LGBTQ community have very high incidences of sexual assault. More than 4 in 5 female rape survivors report that they were first experienced sexual assault or rape before the age of 25. Approximately half of all transgender people have been sexually assaulted in their lifetime. These are staggering numbers, actually. And honestly, we know for a fact that not everybody actually reports that they've been assaulted. So these numbers are probably not the real numbers, right? Even though they look pretty bad, but I don't think they're the real numbers. College women are at greatest risk. Women ages 18 to 24 are 3 times more likely than women in general to experience sexual violence. Most 80 to 95% assailants are known and 50% occur on a date. And we're going to talk about this with the drug facilitated sexual assault. This is very, very common, especially in college campuses where they actually say August, between the months of August to November are the highest numbers, because you have all of the freshmen that come in. And so, they just got out of their homes, they're by themselves, and now they're ready to party. They're not within their parents' control. And so they go out and party, and then they don't know that they're drinking, and then they get sexually assaulted. Sexual assault is traumatic, and we have to talk about trauma in a way. All of us have been traumatized in our lifetime. I don't know if you've heard about ACE, but there's such a thing called ACE, which is an adverse childhood events, where we all experience trauma one way or the other, whether it be even from parents, sexual, emotional abuse, physical abuse, neglect, racism, discrimination, poverty, war can cause trauma, right? It can be a single event, it could be multiple events. And of course, the more traumatic event you experience in your lifetime, the more that it's going to cause some physical, emotional harm or adverse events. Common responses to trauma for the sexual assault survivors: fight. I'm not sure if you've heard about fight, flight, freeze, or fawn. And by the way, feel free to ask any questions if, along the way, if you need to ask questions. The reason why we have to talk about the fight, flight, freeze, fawn response is because we want to not traumatize. That's a double negative. We don't want to re-traumatize these clients. So I'm pretty sure you've heard about sometimes even healthcare providers, law enforcement, sometimes we re-traumatize our patients by saying things that we don't mean to re-traumatize them. For example, all of us experience trauma or respond to trauma in different ways. Our brains are just wired all differently. Someone in a bad situation might fight. Someone might run, which is flight, and then someone might just freeze. Okay, this is very common in sexual assault patients. I hear this a lot. Some of our we call them clients or patients. Some of them will say, you know what, I just went ahead and just had him do whatever he needs to do because I was afraid he was going to do something bad. So they just go with it. The fawn response is more of a, they kind of like just tell their perpetrator, like good things about what the perpetrator is doing or whatever, just because they want to appease them and not cause any more harm because they're afraid. So sometimes you'll hear folks that say, hey, I've been assaulted. This is what happened. And then you'll hear someone hearing the story say, well, if that was me, I would have run or I would have fought that person or I would like slap him. But not everyone responds to trauma the same thing as, you and I do. So I don't even know what my response is if I have, at some point gonna be, knock on wood, sexual assaulted, right? I might be a very strong person and say I'm gonna punch this person in the face, but when I'm at that situation, I might not be able to do anything. I might just freeze. Who knows, right? We all don't know what our response is. A lot of the times too, there's memory loss. So when they're traumatized, they won't be able to remember some stuff. So sometimes they might remember the end part of the assault, and then they're gonna say, oh, actually, you know what? This happened too. And sometimes during a history taking, when we do our history taking, we're going to ask them a follow-up question. And it's like, okay, do you remember him, putting their hand on your neck, which is for strangulation? And they're like, you know what? Actually, I do remember that. So sometimes their stories might not even make sense because that's part of the trauma response. They'll have triggers and flashbacks. That can cause them to feel and react as though they're back in a traumatic situation. I know I have been in a house fire, and so whenever I hear a fire truck coming, I always get nervous when I hear that because I was in a house fire. I literally fell down the stairs just trying to run from a fire. So that's my trauma response. Oops. So the Solace Center, I wanted to show you kind of like a picture of where we are. So this is our receiving area. Forensic exams can be scheduled in advance through the crisis line. So that's our crisis line number. This area of the picture is where we receive our patients. We do our history taking. We do our data collection. And we have a separate exam room where we do our forensic evidence collection. So our staff comprises of me, our sexual assault case manager, Madison Howard, Grayson Thornburg. They're very great case managers. We have right now a team of 12 registered nurses. These nurses are either retired nurse practitioners. We have emergency room nurses from Wake Med, from UNC Rex, and from Cape Fear, and some from UNC Forensic Program. So we have and some of them are very experienced, have been with us for years, and most of them have national certifications also. And then we have our volunteer SARAs. They're called Sexual Assault Response Advocates, and they also receive specialist training to provide support and advocacy to our survivors during the sexual assault exam. And they're also actually needed by us as a chaperone, because when we're doing our exams, we have to have someone there because a lot of these exam is pretty involved, and we need some chaperone there, which is best practice according to a national protocol. So for the kit collection, if the assault happened within 120 hours, then we can do a kit. And sometimes it could be just above 120 hours. We consider doing a kit for those. Some of our referrals are coming from the hospital systems like WakeMed, Duke, and UNC Rex. We do have walk-ins sometimes. If they do call, we have patients that just call. They don't go to the hospital. We want to make sure that they are medically stable. If law enforcement calls us for to schedule a kit, we would prefer that. Well, sometimes law enforcement brings us the clients directly, but unfortunately, our nurses are not there on site, so we have to kind of activate them. They have 1 hour to respond to the Solid Center. So if they're walking in or they're brought in by law enforcement without an appointment, that could become problematic. They might have to wait a little bit for the nurse and the SARA to respond. So again, we see 16 and 16 years old and above. For the 16 and the 17-year-olds, we're going to need to have a parental consent. So the parents have to be signing the consent form. Now, sometimes we do have cases where the parents are not able to come. We are able to do a phone consent with another witness to do that. So with our kit collection, we got to get the, again, informed consent for the adult patients. And we always tell them, we have to tell them what entails with the collection of the kit, that even though they sign the consent form, they don't have to say yes to everything. Sometimes we get into the exam room and then we're telling them this is what we're going to do next. And they're going to say, well, I don't feel comfortable doing that now. They can always say no to any part of the exam, even though they have signed the consent form. That is actually the trauma-informed care, the proper way to do trauma-informed care. We got to get patient assent also, meaning they have to also assent, not just sign the consent form. We gather data and history. The medical history is also important because we do give STI prophylaxis. So we give them certain medications. So we're going to know if they're allergic to some type of antibiotic, because we do give antibiotics, and to cover, which is CDC recommended to cover for common STIs in the community, which is gonorrhea, chlamydia, and trichomoniasis. And then we also give, and this, we don't give it there, but we give a prescription of the medication. We also give pregnancy prevention. So it's either Plan B or Ella. And then the head to toe medical examination. This is still a medical exam at the end of the day. This is not just a forensic exam. So we make sure that we check them and make sure that they have no injuries. And if they do have injuries, we also take pictures. So we have a cortex flow that we use to photograph, any bruising, any cuts, any lacerations, anything that we think that might be needed for us to document. And then we do discharge planning. We got to ensure that even though we've given them some STI prophylaxis to cover for STIs, we want to make sure that they follow up with a medical provider. It's very important because we want to make sure that they don't get STIs or any other STIs that they might get, or HIV also, for HIV follow-up. And then there's a chain of custody. So we have to kind of, after we package this kit, we send it either, depending on if they're reporting or anonymous, which I'm going to have another slide later. We either send it to law enforcement or we send it to the storage facility, or which is called LESS, or law enforcement storage. So I want to talk about drug facilitated sexual assault. We call this DFSA for short. There's loss of memory. Mostly alcohol is involved, or sometimes they don't know that there's drugs or date rape drugs are being used. We usually collect blood and urine. Blood if it happened within 24 hours, urine if it's within 120 hours, depending on the time frame. Most of the time, our patients who are DFSA'd, they will really say, I don't remember anything. I don't even know if something happened. So we kind of, but we ask them, well, tell us more about how you woke up. So we have to kind of, in a way, have to think about what questions we can ask that might, trigger for us to possibly do a kit. So most of them will say, well, I woke up in a stranger's house with no underwear or no clothes on. So, right there and then it's kind of like a red flag. We probably need to do a kit for this person. Uh, a lot of the times they actually there's a lot of victim blaming from family members, from friends, or even the patients themselves will say, I shouldn't have done this, I shouldn't have done that. But I always tell them, you know, seriously, us women should be able to have fun, get drunk, without being assaulted. This is not your fault. So that's the best way to approach that, because a lot of the times they really, really blame themselves. So talking about reporting and anonymous reporting, so there's two types. And I forgot to say, the kit collection is actually paid for by RVAP in North Carolina, which is the Rape Victims Assistance Program. So they don't really have to pay for anything for that. Also, we can offer, for the prophylaxis for the STIs, we can offer a medication voucher, which is also paid for by RVAP, which is the Rape Victims Assistance Program. We use this a lot especially for students who come to us and they say, I don't really want my parents to know I'm under my parents' insurance. That's the best way to use a medication voucher for us. So then, their parents won't know that they, got these medications, because sometimes we do have students that say, my parents are strict, I don't want them to know. And then some of them, they know, they talk to their parents and all of that's fine. But a medication voucher is really good in a way for those folks that don't want their parents to know. So there's two types of reporting. One is reporting to anonymous, which is the obvious one. They want to talk to law enforcement. It's either they've already reported to law enforcement while they're at the hospital, so they have case numbers, they come to us, we just call RPD or whichever law enforcement or whichever place it happened. And then we'll give the kit to the law enforcement. The anonymous kit is we still do the same thing. So for both, we collect the kit, but for anonymous reporting, they don't want the police to get involved. So we just package the kit as is, and then we send it to law enforcement. We always tell the patients that they can report at any time. In North Carolina, there's no statute of limitations. They can report tomorrow, the next day, the next week, 6 months from now, a year from now. Again, there's no statute of limitations. But we always tell folks, if it's not reported and it's anonymous, it literally, this box will just sit on a shelf in a storage facility and will not get processed by SBI. So there's always a chance that DNA will degrade, and also, so you might lose the evidence. The other thing too is there's, in North Carolina, there's what we call the North Carolina Victims Compensation Program, where if you're a victim of a crime, they will reimburse you for loss of, let's say, if you incurred expenses because of that crime, hospital bills, they can reimburse you. If you lost your job and you need, financial help, they can help with that. The problem is if they're reporting anonymous, they have to report within 90, I think it's 60 days. I'm not really sure. Sean, you might know. 60 days or 90 days, they have to report in order to get the compensation. How to support someone who's experienced sexual violence, right? We want to listen without judgment. We just listen, right? The best thing to say is like, what can I do for you? What do you need help with? We're not going to say, well, you did that to yourself. I literally had a client who, she went on a cruise and she was assaulted on a cruise, and she had no memory. She was DFSA, and she said that her father told her it was her fault that happened to her, which is kind of crazy. That's coming from, but it's very common. It's not unusual for folks to say, well, that's your fault. You drank too much, or you wore that dress, or whatever. Support their choices by asking what they need. Honoring, yes, every survivor's healing process is different, right? So, what do they need? Like, do they want to report? Do they not want to report? Then that's up to them, right? We're not going to force them. We're not going to say, well, you need to report this, right? It's up to them. it's their choice. Provide information, and that's what today. So you know that we're here at Interact Solar Center. Our no,
We can't hear you properly. Hello?
first.
There is, I don't know if about everyone, but I couldn't hear you for the last 30 seconds. Can you all hear her?
No,
Please.
No, I can't hear her. Let me try to call her on her phone.
She is there, but
I think she's frozen. I think her
yeah,
screen
she's
is frozen.
frozen. Yeah.
Local resources also, so that they decide to come to us. We're not going to force them.
Hello?
Can you hear me now?
Yes, I can hear you now. You're
Can
off
you hear me
video.
now?
Yes, I can hear you now. For the
Oh,
last 1 minute, we could not hear you.
oh. Well, I'm kind of almost done. So,
Okay.
can you hear me better now?
Yes, most
Oh,
definitely.
so again, it's choices. It's trauma-informed care. We want to respect what choice they do. We're not going to force them. You got to go to the Solace Center. You got to get this done. It's really up to them what they want to do moving forward after the assault. Your role, if you know someone who's been assaulted, is to offer empathy, respect, support. Good words to say. I believe you. I support you. What happened was not your fault. So again, this is our numbers if you all need it, but we're going to share probably these slides. I'm not sure if we'll be able to share the slides, but they have my number. Kiran has my number and my email number and my email. So if you all need to contact me, you can always contact me. And that's it. Do you have any questions? Anyone has questions? I feel like I went through that really fast.
That was awesome. Thank you so much for this presentation. Very informative. If anyone has a question, please feel free to ask her. And I will also I'll send to all the attendees today. I will send all the slides along with Dart's contact information if you have any more questions, even after today's discussion.